That's wonderful. Okay, it's 7 o'clock and it's time to get started. Let me just see if I can see that people are logged in. Very, very welcome to this webinar hosted by Sleip, where we'll talk about gait analysis and better care, better business. And I'm super excited today to have very prominent guests here that will talk about how they use gait analysis to provide better care and to make better business. But also in general, for the first time, we will actually sort of have a bit of an open mic at the end of this webinar where you guys out there are able to ask questions to our panel and to our guests, and I will have a bit of a discussion. So just a bit setting the scene of what we'll be doing today. See if we can get this rolling. We'll start with a small intro where actually we will start by asking you guys out there some questions about who you are to get to know each other a little bit. And then our 3 or actually 4 experts are going to give us a bit of presentations about gait analysis in general. So we have Marianne Marshall-Gibson here, Andrea Nissen, and Anushka. And the funny thing is they're actually broadcasting from 3 different parts of the world, so 3 different continents. And then from Sleip, we also have Dr. Philip Braganza, who will be talking a little bit about new features in the Sleip application. And then we're going to round up with this Q&A session where you get to raise your hand. We will unmute your mics and you can ask whatever you want to get a discussion going. So just starting with some questions to you guys. Let's see if I can launch a poll. So first question is going to be, where are you from? Just to see a little bit who's awake and if it's early or late. Wow, and Europe is in the lead. Not very surprisingly, I think Anushka has the feeling that people in Australia and New Zealand are not really awake yet. There are some people joining from over there as well. Yeah, and we have very good representation from all continents. And I'm going to tell you that about 70% of us attending right now are from Europe, 20% from North America, and then we have South Americans, we have people from Asia, Australia, New Zealand, and also from Africa. Most welcome to the webinar. We will do another question. So what is your role? What would best describe your role in equine health? And this is really exciting for us because most of the communications we have, of course, are with veterinarians who are the biggest users of our tool. But we know that there's a lot of interest out there from trainers, from vets in the regulatory business. So racing regulations, for example, chiropractors, physiotherapists, farriers, and regular horse people. So we have a quite big majority of vets in the audience, both from solo practitioners, hospitals and clinics, academic researchers. Hi and welcome. And we also have some residents and students and physiotherapists, farriers, trainers, and others. Welcome to you guys who are others as well. Exciting to see so many representations, and I'll actually share these results to you guys. I think you can see them now that there is quite a spread of people in the audience. We will take another one. What's your, let's see if I can do this one. See if we can stop sharing this one. And then we'll take the third question, which is your knowledge in gait analysis. And don't be shy. You don't have to be experienced to do these seminars. They can be, I think, both an inspiration to people who are very new to this topic, but also to people who actually are running with their business with gait analysis. And just to get us started, I will end the poll very soon. So please click away. Yeah, I think we're good there. I will share the results with you guys so you can see that a lot of the listeners are experienced who use it regularly in their practice. We have some that are a little bit less experienced, but also some people that are have very limited experience, but keen to explore. So we hope that we can cater something for this entire audience. So we have one last question, and that is your interest in objective gait analysis. So you can choose between these options. Are you most keen to improve clinical accuracy, support long-term case tracking, enhance communication with clients, add new services and revenue streams to your practice, which is actually very important because vets need to earn a living too. But also in general, there's often an interest in exploring technology for equine health. So I am going to end the poll very soon. So click away, and I will share these results to you as well. You can see that there is for sure a very big interest in improving clinical accuracy. And I think, to be honest, this is very much coming from the vet side of things. We often just want to be better. And I think that's one of the things that I really love with our community, that vets often do things for the sake of horses and just to, do things better, make their job more precise. Thanks, guys, for letting us know a little bit more about your backgrounds out there. We will actually end the pause session now, and we will get started. So the first person out who will give us a bit of info from clinical practice is Marianne Marshall Gibson. And yeah, I'm a little bit nervous about presenting this right. But Marianne, you're an experienced orthopedic vet. You run your own business, which is quite renowned, and I've heard you talk at the AAP. And you are a diplomate in sports medicine rehabilitation in the American College. And I know you're also certified as a chiropractor and work with acupuncture. So you have a very broad skill set in orthopedics. So super excited to hear a little bit more about your practice.
Thank you. And
stop sharing.
I will try to share my screen and see if this works. Let's see here. All right.
And while you get going, Marianne, I will tell people that if you are very, very keen to type a question, you can do that in the Q&A. Otherwise, we'll let you speak at the end. And then if you've typed something into the Q&A, we'll try to see if we can answer along the road. We'll also save your questions to try to, answer everything we can. But raise your hand at the end in the Q&A session. Thanks.
All right. Is that working? Are you seeing my Zoom sidebar here? I can try to minimize it. See if that works.
This looks good.
Okay, perfect. Well, I want to thank Sleip for having me. This is very exciting for me. So, as the wonderful introduction goes, I have a sports medicine practice based in Berthoud, Colorado, which is just a little north of Denver, about 40 minutes, and then a little bit south of Fort Collins and CSU, about 30 minutes. I started it as an ambulatory sports medicine practice in 2017, and then in 2021 we expanded and now have a full service rehabilitation facility. So that's been exciting. And then my interest in Sleip, honestly, yes, it was to have an objective measure for the sports medicine side of my practice, but really for me, and what I'm going to talk about a little bit more today, was the rehabilitation side of it and having an objective measure to go back to and reference as we had these patients come in and progress through our rehabilitation program. We obviously, we have a lot of local veterinarians that refer to our rehabilitation facility, but we do have clients and patients from out of state or out of area. And, it's hard for a lot of these owners to be away from their loved horses. And so it was just another added piece of data we could provide with them on a weekly basis to make sure that they understood that their horses were actually progressing and they were feeling good about the money they were spending on the rehabilitation. So we do use it a little bit on our sports medicine side. So I will go into a little bit of that, but I think Dr. Van Oppen is actually going to get into that a little bit more detail a little later on. But in our practice for the soundness lameness side of things, we do use it as a baseline soundness record. So, right now we're getting into springtime, spring tune-up. We're getting into the beginning of show season. We're going out and doing a lot of, baseline flexions and things like that. So we can see where our patients start in the beginning of a season, and then kind of use it to monitor them as they progress through the season. When do they start getting a little bit sore? When might they need some maintenance, things like that. And the nice thing is with the Sleip app is you can share the ability to upload videos with your clients so that if they're at a show and something feels a little bit funny and they're out of state, they can upload quality videos that get sent to you so you can review them instead of trying to see these lovely little pixelated things that you can't know what's going on with the horse, and you try to 10 different ways to get these videos uploaded and still can't see what's going on. So that's been nice. We'll get into this a little bit later too. Even though the Sleip app wasn't initially designed to monitor flexion response, we have started to be able to do that a little bit more consistently as the app has progressed. And then rider effects. The Sleip app does detect whether or not a rider is on, which is nice. And you can definitely see a difference between when a rider is on versus just lunging the horse. Whether or not that's clinically pertinent is up to you, but it's kind of nice to show somebody, yes, there is a difference between a rider and not having a rider on. I'll get into this a little bit more, but objective measurements of response to blocking, that's always nice because I know at least sometimes we'll get into those situations where a horse blocks a little bit to this, a little bit to that, and those can be frustrating. And this can just help from a numerical standpoint or objective standpoint to say, yes, this is how much we got in response to that particular block, or even convincing an owner that the horse blocked or was lame. And then additionally, recheck exams between practitioners. There's situations like, heaven forbid, we take a vacation and the horse needs to be rechecked. So one of our very qualified associates goes out to see the horse and recheck the horse, but we can have an objective measurement to see how much better that horse is doing, gives the owner a little confidence boost that at least we have this continuity between practitioners. So I'll go into a couple cases that we had at our rehabilitation facility that kind of were proof of principle to me. So for those of you who are not familiar with the Sleip app, so this is an example of a PDF printout you can get that kind of summarizes what's going on with the horse, but you'll get a couple different readouts. So over here, the purple is going to be a pie chart, and you're going to have your left front, your right front. You're going to have impact or push off, depending on where we are in the pie chart. And then over here, in the blue is going to be your hind end. And you'll see all these vectors. These are just all the individual steps that the horse takes that Sleip app is coming into or using into account to come up with a sum vector. And then for the owner, it's a little bit easier to kind of come up here and see these nice little summary pie charts that kind of use the vectors and the nice colors that I know we'll go into later as well that show the severity of the lameness. So this particular horse was a 10-year-old quarter horse mare who was used for barrel racing and breakaway, rodeo breakaway. And she had a chronic right hind lameness that really hadn't improved over about a year period. And so she came into us, and there was a question of whether or not she had had a hind suspensory injury, and we proceeded to work her up. And so what we can see on the left here, this is her straight line analysis, where we can see she had a pretty significant severe right hind lameness. And then lunging to the left, which is where we could see it a little bit more obviously, at least in the lunging pattern, still had that orange or moderate to severe right hind lameness based on the baseline. And when we went ahead and blocked her out, where she ended up blocking out was to this right hind medial femoral tibial joint block. And so you can see here, the right hind with that block, which you can see down here as well. It has a nice little summary. Has diagnostic analgesia been applied? Yes. Where? Here. And this can all be included in that summary there. But she blocked pretty darn nicely to that right hind medial femoral tibial joint. I know this next case kind of was a proof of principle to me. I know some of the skepticism behind the objective gait analysis things, especially the ones that have inertial sensors that where you have to put something on the horses. Lameness isn't just in 2D, right? And a lot of what these things measure is dorsal ventral displacement of things, particularly in the hind end, looking at that tubercoxae. So this particular case really made me believe that Sleip could at least detect a little bit more than just that dorsal ventral excursion, at least in the pattern that was presented. So this particular horse was a 6-year-old quarter horse gelding who is used for barrel racing. And he came into us. He had a history of a mild right hind medial suspensory branch injury that he had healed. However, he was still showing some issues with that leg. But when I watched the horse go, I would have told you that this horse was at least a 2 out of 5 lame on the AAEP scale. But what was interesting about this particular case is the characteristic of this horse was he had a very axial placement of that right hind that I don't feel the severity was necessarily picked up on with the Sleip app. However, the pattern was. So you see that here on the right hind straight line analysis initially, it did pick up that there was something not quite right with the right hind. We went ahead and blocked that old injury there, and maybe the horse got a little bit worse. But when we went and continued to block him up the leg, what we noticed was when we finally got to that deep branch of the lateral plantar nerve, the uh, the pattern changed. And so, yes, the right hind improved, but you could see that the front end, the mild front end lameness was more pronounced. So even though we might not have agreed with our eye with the severity of the lameness because of the dorsal ventral component not being the primary issue, Sleip was able to pick up on this lameness and detect a difference in the pattern of the horse as it was going. So I thought that was pretty significant for me. This is just a little example of how we send our patients home and use the Sleip app printouts for our patients. So when our horses go home, we always send them with an intake and discharge comparison. So we use it not only do we take intake and discharge pictures, but we have in our binder our intake and our discharge summaries here so that the owners know exactly where they started and where they ended up at the end of their rehabilitation program. The other nice thing is, for example, this particular horse lives 4 hours away. So again, that nice feature of the Sleip app, we can share the ability to have the owner at home upload some images or some videos so that we can monitor their progress at home, or their regular veterinarian in the area may have the Sleip app and they can continue to follow this horse's progress through their Sleip app at home, and they have this kind of as a guide. And then we also use it as a weekly patient monitoring system. And so this next slide just shows the progression of that particular Hope mare that blocked to that medial femoral tibial joint as she came in November 17th of 2023 with that severe right hind lameness, as she ended up having some arthroscopy and follow-up treatments. And as she progressed, March 19th, she was better. And then by May 28th, she was pretty darn sound on that right hind. So this is just another way that we can show progress to our clients that our rehabilitation program is actually working. And lastly, how we charge for Sleip. We do include it in all our rehabilitation and conditioning programs. And then we have some options. So we do some lameness exam add-ons. So if we're on site and we want to add it on, we will add in a $35 per use fee. And then because a large part of what I do and what my passion is rehabilitation, I do offer outside telemedicine and virtual rehabilitation consultations to veterinarians across the US, and I'm happy to do it across the world too, if anyone's interested. But I do work with the veterinarians, and if they don't have Sleip, we will have this ability to do a $50 add-on consult so that I can share that with the owner or the veterinarian so we can get live action shots and as we progress through the rehabilitation program to make sure that we're not causing any issues as we progress through the program. And then finally, we have just started these Sleip subscriptions for our clients just to help with continuity of care. And so we started for our rehabilitation graduates a $75 subscription fee for a year that includes a certain amount of video submissions. And then if they require any follow-up telemedicine or anything like that, we give them a discount on that. And then it's just a little bit more for our clients as well if they're not already established in the Sleip system. So that's how we use it in our rehabilitation facility. And I think I will hand it over to Dr. Neeson.
Yeah, thank you so much, Marianne. That was really, really nice. And I'm really personally glad to see that anyone, out there listening can also actually contact you to get that type of additional support in clinical interpretation of these measurements, because that's a very important service. At Sleip, we try to help out, but for sure, being able to contact a clinician who has been using the system for a long time is a very, very big benefit for a lot of people that get started. So thanks for that. That's really, really nice. So next up, Andrea Louise Nissen, with us today from Denmark. Thank you so much, Andrea. You are a PhD in equine biomechanics from Copenhagen University. And I know you're also educated in osteopathy for horses and that you run your own practice. And excitingly, Andrea is the veterinarian who uses this sharing feature the most. We can see in the data, which is really exciting because I think you are making a very big change in how you can provide care, just like we saw from Dr. Marshall Gibson. So take it away, Andrea.
There. Can everybody see my screen?
Yes, we see your screen.
All right. So, as you said, I'm a vet. I have a PhD in biomechanics, and I am an equine osteopath. At home, I'm a breeder of Danish warm blood horses, and I'm a hobby rider of those and training the young horses. When I work with foals and young stock. I see a lot of referring cases. A lot of the horses I see has already been seen by many vets with year-long stories, and that type of horses my goal is to fix or to find the reason for the inability to fix the horse. Then I work a lot with high performance horses where the goal is to increase performance, increase durability and welfare. When I work, I'm first a vet and I use my vet hat first. And if the horse is good enough to treat osteopathically, then I do that. If I need further diagnostic imaging or anything else, then I'll refer the horse to a hospital nearby. The types of horses I see are then, it's multi-limb lame horses, it's bilateral lame horses, a lot of hind limb lameness, and neurologic horses with neck problems, back problems, and conflict behaviors. And what I don't see is on the picture, I don't see any hoof abscesses, and I almost don't see single front limb lameness because that's fixed by other vets. Then I see some horses at home, at my own place, they drive to me, and others I see in the field. All new horses coming to my place, I always give them an access to Sleip, and they do Sleip from home. And by following this structure, I know what the horse looks like from home. And an example of the difference between a horse at home and at a referring place is here. So this is a horse where you can see on this side, it's the 5th of October, and this is on the 9th of October. And here you see the right front and left hind lameness. And here, coming into the hospital, You can see a little bit right hind lameness, but this was, for the vet I referred to, not enough and not consistent enough to do any blocks. So this horse was sent home. And when she arrived home after 2 days at the hospital, she was as lame as when she was sent off. And I avoid this, not getting the full information by making them Sleip from home. Then in all my sharing, I share with owners. That's the largest group. A lot of trainers as well, other body workers, physios, osteopaths, chiropractors, then hospitals, local vets, and farriers. So it's a large group of professionals who surround me. And I give courses. So I think I had to say something about business. And I give courses in biomechanics where I include how to use Sleip. And I have two types. I have for horse owners and I have for professionals. They pay for the course and then they pay for Sleip access. And then they only pay extra if I have to be involved. Sometimes I have, and sometimes they work the rest by themselves. And now when the physio access that you have created this since I think the last half year or so, it's a very good thing, because then they can see all the colors and everything without me sharing that. This is what I do the most. So it's before and after treatment. And when I do the osteopathy. And here you see, so these horses are not very lame horses, but here you see a small left hind and right front asymmetry. And this is at approximately 9 o'clock. And now after treatment, I do it again, and you see something has changed in the symmetry. And I think that's interesting to have that, because it's so small changes, but it's still, it's something where you can document what actually happens. Then I'm very happy with the Sleip as a control in our team, because there's always the question of expectation bias and wish bias. And if you have worked for an hour with a horse and put new shoes on, or whatever you've done, trained it, and the horse seems happier and more relaxed, then you also have the tendency to think that it's more symmetric. But having Sleip, we actually can see, and I can monitor from a distance, if this trainer is actually right, that the horse is better symmetrically, or if it's not. And sometimes the horse is, of course, better, as the case I just showed you. And sometimes the lameness is just more clear, or, a bilateral lameness becomes unilateral, or the lameness changes limp. So this is where I think the Sleip really saves us, because if you have looked at a right front lameness and left hind for a long time, and then you've done something and the right front has disappeared and you're happy, but you just didn't see that the right hind came up. And Sleip makes us not miss this. And I love that. Then I also use it as knowing the normal pattern in the high performance horses. So like Dr. Marianne said, so following the horses on a long term when they compete. And before Sleip, I went to see and do flexion of this horse every time he had a competition. And I often found a mild left front asymmetry. And after Sleip, the rider can just send me a Sleip when she comes home. And if there's something off, so something different from the slight left front asymmetry, then I will go there. Otherwise, I won't. This horse, I'm just going to show you. So what is going on here? Can you see? Yeah, you can see. So here the left front lameness, you can see that a little bit. And here you can see the left front as well. This is on the 7th of July. And then it's been left front all the time, and there's nothing in flexion, and every time it's there, it's the shoulder and the first rib and this area, and then we do this and he's better. But then suddenly in November, there was a right front. and I went there to do flexions. And as you see, so first I flexed the right hind, and there was a clear positive response to that. Then I flexed the left hind, and also here. So now we had a bilateral hind limb lameness going on, which was impossible to see from the data here on the 7th of November. But I really, really like Sleip to have this thing. And of course, the data over here with the flexion would probably have been looking different if I'd flexed the left hind first and then taken the right hind. But it's always something that I take into account, evaluating what means most for the horse. Then I also use it, and you also said that, the Marianne with and without rider. This horse has a little bit of neurologic deficits and also CT findings in the neck and in the right front carpets. And on this side, you see her lunging, where you see a clear asymmetry. And then here you see her ridden. And for the eye, you cannot see any lameness ridden. For the eye, she's obviously lame when lunging. And the rider has found a way, because we know what's going on in the neck. So she's found a way where she can do head neck position and place the shoulders so that when she rides, she's very comfortable, the mare. Then I use it for pre-purchase. And it's actually a pre-purchase. And before Sleip, it was, as Marianne said, you see photos and videos like this where they ask you, can you see, is this horse fine? And it's impossible to see anything. And now I use it to select horses which actually has a chance of passing. And I only use it with my own owners. So that's also because I have this big community. I do have some owners who need new horses, but I don't do it if somebody has never heard about Sleip, because that will make me change the price, because that would make a lot of extra communication necessary. But for my own owners, I use it, and I avoid wasting time driving to see a horse, and that can be rejected within 10 minutes because the owners cannot see that the horse is lame. And then I use it as a documentation for a baseline before we change environment, because we know that changing environment, you buy a horse, something happens. Then this is an example where I created a Sleip access for an owner who wanted a horse, and you can see she was out watching on a lot of horses, all the dates, you see that, and it's an example of 66 measurements in 18 horses. And then we decided to go and see one horse because she had seen the horse twice, and it was good to ride, and there was only a very mild left hind and right front asymmetry. And I was like, okay, she's seen so many horses. I have to say that something can be used, might be used. And this is how the data looked when she sent it to me. So you see there's slight asymmetries. And I wanted to go there to check if maybe I could do something when she bought it about the scapular or about the knee joint or whatever, increase range of motion, and then the symmetry would be better. Then this is just to see the circle. You also see it's mild asymmetries. But then when I came, it was the right front was fine. Now it was left hind, left front. And then I did the flexion of the left hind, and it was a disaster. It almost could not walk. And it always surprises me when a horse who's competing and doing well feels good for the riders, that they can be this lame on flexion. But it showed me that Sleip had actually already picked the leg for me beforehand. And in January 2024, I was surprised, but now I'm not surprised. So I have more than 400 pre-purchase films, and I've seen this again. So in my Sleip account now, I have 13 people who wanted to buy a new horse. I have 431 recordings, 77 horses, and 26 horses that went to pre-purchase exam, a real pre-purchase. I did 9 of them, and my colleagues did 17 of them, and 10 of them were sold, so passed the pre-purchase. And the reason for rejecting the rest of them was positive flexion test of the leg that Sleip already had picked out as a small asymmetry, and then also hard surface asymmetry in also the leg that Sleip had already picked out. Yeah, I think my time is up. How am I with time? Can you say that, Ellen?
I think you can finish, Andrea. And we will maybe eat a little bit of the Q&A time, but I think
All
this is so exciting. So finish your presentation. That would be nice. Thanks.
Okay, so this is about knowing the baseline. So these data is from a mare that was sold in March last year. And you see there's quite a lot of scar tissue. This is the left hind, and she had a small toe drag, but she passed the flexion tests and x-ray and everything, and she was really good jumping. So everybody was happy, and they bought her and competed her. Everybody was happy, and she had the same toe drag. Then this happened. It was in May. It should be impossible, right? And then actually you see here, you see the Sleip before the accident with the left hind, old injury, and you see the right hind thing, and you see now we have a perfectly symmetric horse. Yes, this one can really be sold, right? But this is the thing about knowing the baseline, because of course I knew that it was not the right thing for this horse to have this type of asymmetry. Here you see the measurement when this scar tissue developed, and you see only on the right circle she has really a asymmetry, and then you can see the combined. It's almost nothing, but it's just a difference for this horse. And half a year later, I forgot to put that one in. That's fun, right? But half a year later, she was back to the left hind asymmetry as she had before. I'm interested in helping horses and not very interested in money. So in the beginning, I thought I will not ask my clients to pay anything before I trust the quality of the Sleip app, and also before I know how to interpret the data. So I decided for the first half to full year to not charge anything extra. And I did this because I wanted to learn how Sleip worked, but I also did it because I wanted everybody to use it. So I wanted all my clients to start using it and to be like wanting it. And that's also what happened. So what I'm doing now is every horse I see for a treatment, they pay for the Sleip upload after treatment included in that price. A pre-purchase is 42 euro, and then they have the access. Then if they decide, okay, this horse I want to buy and it looks like it's not very lame, then they can ask me to watch the data, and then they pay for my time. Yes, so thank you for listening. This is my Yuna with a very asymmetric leg when she was born and more symmetric the year after. Thank you.
Thank you so much, Andrea. That was a lot of fun. And I think it's more people than me who are sort of have a lot of questions that we would love to ask. But we're going to jump to the next speaker, Anushka van Oppen. Dr. van Oppen, very welcome. And we're so glad you're joining us. Very early in the morning.
Early morning croaky.
Yeah, you're very brave. And Anushka, I'm so amazed by the clinicians that are actually here today, because all of you are very passionate in terms of horse motion and, well, biomechanics and rehabilitation. So you're a very interesting crowd to listen to. And you also, Anushka, you're a certified veterinarian, of course. You have additional surgery education, and you're also a chiropractor or equine chiropractor. And I know you also did all of these wonderful ISOP modules and have worked with Professor Jean-Marie Denois at the Siral clinic in France. And now you run a very nice business of your own, Core Equine Land. So very
Thank you
curious.
so much, Ellen. Yeah, so thank you so much, guys, for asking me to come and have a bit of a chat. Thank you to the other speakers for giving some really nice background in their experiences. And today I'll just be addressing my field experiences using Sleip. And so just a bit of a background of me, I graduated in 2005. And yeah, like Evan said, my biomechanics interest started with doing all my ICELP modules. And that led to me going and working in France, where I developed a bit more of an interest in ultrasound and spinal related discomfort in horses. And because of the things I was seeing on imaging, I was like, I need to understand these things a bit more clinically. And so then I went and did my chiropractic training. And yeah, and this all culminated in me starting my business in 2023. And I guess my overarching goal was to have an equine performance focus, optimizing performance, being proactive in their management. But a bit like Andrea, the reality is that I've ended up with a lot of chronic cases that haven't had answers for months to years, and the clients are really seeking holistic assessment. And so that can just make my follow-up sometimes a little bit scratchy, because sometimes we have some not good answers, but at least the owners have answers. And therefore, having easily accessible gait tech in the field was essential for me, really, to help walk these owners through what I was seeing and the rationale behind what I was doing with their horses. So yeah, I started integrating Sleip into my practice. I had experience with an IMU system, and I found that the data was really comparable. I really liked that the visible measurable outcomes were presented in a different way that made a lot more sense, I think, to owners, rather than two different plot systems, and then having this overarching view where they could quickly see, which limb we were looking at. I love the fact that there's video documentation. I'm a very regimented person with my documentation, but sometimes not so with my notes. And so having the video easily accessible there was great to go back and have a look at what I did on the day. And also, it's really helped me learn what we're actually looking for. And by going back and having a look at the stride plots and correlating the stride plots to, I guess, where the data is coming from. And it's been a really great learning tool for me. So having this really clear data, I feel, has improved like my client communication, and therefore their trust in what I'm kind of telling them. The clients therefore become a big part of the journey. And so when they can see what we're seeing, their rationale behind why we want to treat something or manage something is a lot easier to get over the line, and they feel really on board with it. When I started using Sleip, there weren't a lot of people using it in Australia anyway, and I felt like it was a really great tool to set me apart from other practitioners. That it was an easily accessible tool, and only a few places had the IMU systems because of cost. So it was nice from that perspective. Having the ability to remote assess patients was really fantastic, because a lot of my clients are geographically far away. I do runs in particular areas. I find it fantastic for subtle or inconsistent lameness. And similarly with Andrea, we can keep monitoring a lameness to try and work out when is the best time to block relative to the workload of the horse. I use it for follow-up treatment, post-treatment, and during rehab. So for me, clinically, most cases I see will have a Sleip, and I either do it for the initial assessment or follow-up. I use it for the baseline data for sport horses and finding a similar, as discussed before, about what is the baseline for a particular horse going into competition season, for standard lameness workups, for complex diagnostic cases where there's multi-limb lameness, and confirming post-treatment or post-block for tracking our rehab patients. So this is a nice case, Mac. He's an 18-year-old thoroughbred gelding. He's not anything fancy in terms of high-level performance, but I think it's a nice example of a lot of the standard patients we see every day. So I initially saw Mac in March last year for right fore lameness, which we were managing as a foot-related problem. And I was seeing him every 4 to 6 weeks for chiro, and he was showing subsequent improvement with farriery. And in a couple of months after the initial presentation, he was showing more just low-grade left front and right hind asymmetry. But in September, he had a sudden worsening of the right hind lameness, which was 6 months after his initial presentation, and that was noticed during a jumping lesson. And so we can see that there's this quite decent lameness on the video. We started with nerve block examinations, and there wasn't really a substantial improvement to the blocks. And so then before blocking the stifle, I decided to image it, and we can see that there's quite substantial effusion of the right hind medial femorotibial joint, and also this periarticular remodeling on the femur, and quite substantial meniscal changes at the insertion. Because of the ultrasonographic findings being pretty obvious, I didn't block the stifle, and I elected to treat it instead. And the owner didn't want to do x-rays just to minimize cost in that point. So we treated both stifle joints with triamcinolone, and we started a rehab and conditioning program. And I use quite regularly the EQ Active platform and an Equiband system for a lot of my cases. And then in January, we treated both stifles again with ProStride because of the meniscal changes that were present. I asked this client to provide me with a bit of feedback, from my own personal business, but it ended up that she was really raving about the Sleip app, which is really wonderful in her review. And so I guess you can see how beneficial this client felt it was in her journey. And this is quite a common feature for me, is that the clients are very interested and eager to find out and understand what's happening with their horses. In terms of how I promote gait assessment, I do a lot of client awareness on my website and newsletters and social media, and just try and encourage people to become engaged and understand why gait analysis is important in making what we do better. So when I started my business, it was a very new service and I didn't have any existing client base. And so I had to just pick my pricing, I guess. I run a biomechanical package, which initially I started at $330, and this included gait assessment and a chiropractic assessment and treatment. And I've just popped that up because the uptake was really good and people have really liked how thorough the assessments have been. If I just do the gait assessment alone with Sleip, it's $285 plus diagnostics and obviously travel on top of that. And I've just rolled out some packages, which just early in the phase of implementation. So the uptake hasn't been really huge just yet, but I'm hoping that maybe there'll be a bit more interest down the line, more so for the performance and the rehab kind of packages. But definitely people are taking up on the remote once-off kind of assessments, and similar to Andrea, I use I'm trying to restrict that to pre-existing clients, because I thought there's a little bit of murky water if you have people just signing up and wanting to check horses, that you might end up with a bit of a situation where a horse clinically, objectively looks sound, but quite often in my experience, objective soundness doesn't always equate to a physically sound horse in terms of spinal assessment. I guess tips and learnings, particularly from my perspective being in Australia, is that 5G is not everywhere here. And so it does get a little bit challenging at times. So if you don't have good 5G connectivity at home, I think that's something to consider. And so I thought, I've got the solution to this problem. I'll just get me a Starlink. And that didn't solve the problem because the upload speeds were still pretty poor, unfortunately. I really like making sure, particularly with subtle lameness, that we have multiple trials to confirm an asymmetry before blocking. And sometimes if it's been a while between blocks, I will do a very quick first trot out and then wait my initial 5 to 10 minutes, depending on what block I've done, to make sure that what we're seeing is real and true in terms of response to blocking. Just be really systematic with your collection of information and how you move horses around. I really like to go back and always have a look at the data values and stride plots and make sure that the data is consistent. Is there really an asymmetry, or just on the averages, is it a true reflection of, is the horse moving its head around a lot, and so it's not a real asymmetry and might just be something that is a bit of a red herring. I love the bar graphs, but at the same time, with the changing colors, sometimes you think, oh, look, I've gone from orange to yellow. But then when you when you actually look at the real data, sometimes the improvement is not so significant. And so I think it's always really good to, rather than just looking at the colors, making sure you're going in and having a good look at the actual values. Sound for me, or very mild asymmetry in a straight line doesn't always equal sound on the lunge. So, I've had some training from a different company for IMUs before, and they were like, oh, sure, if the horses sound in a straight line, you never really need to lunge them. And it's so important to follow up with your lunge and make sure that you're seeing the horse in all circumstances. And also, it doesn't necessarily mean the horse is spinally sound or there's no other discomfort in the rest of their body. So it's really important to assess the whole patient. This particular case had a mild left front asymmetry, which was mostly foot related, but it also showed a mild hypermetria in the examination. And we had these nice X-ray findings in terms of stenosis. And the other thing I would like to say is that it's okay to be humble and admit to clients when we don't always get it right. Like I had cases yesterday where I was like, oh, I think it's improved to the block. And then you looked at the objective data and there was no improvement in it. And I was like, okay, well, I'm just not seeing it. And I think clients appreciate you being genuine and talking through what is happening and showing that sometimes we don't always get it right, but the data is there to really help us do better, and it's for everyone's benefit. So it's okay. Yeah. And that's me.
Thank you so much, Anushka. That was wonderful and a very, very professional run through of how to interpret the data, because I think you have some super important points there in terms of actually looking at the values, not over focusing on colors, but also particularly looking at the spread of the data and the consistency of what you measure. So as Andrea showed us, a very small asymmetry with very clear consistency can be very clinically relevant, but you show the same sort of degree of asymmetry here, and it was sort of spread all over the place with these tentacles going in all directions, and that's really, really important. Thank you so much. We will move along, and then you guys will get the chance to ask questions to the panelists and to the guests very soon. But first, I'm very happy to introduce you to Philippe Sarabraganza, who is running the product at Sleip. And I'm very proud because you are also one of my research colleagues. You used to be heading the entire biomechanics research group in Utrecht, which is one of the most successful groups for many, many years. And you of course, then have a PhD in equine biomechanics and have published a lot of biomechanical papers. And now you're at Sleip, which is a dream come true for me. So take it away, Philippe.
Yes, thank you. Thank you very much, Aileen. And it's lovely to work at Sleip and lovely to be here today and being able to talk a little bit about the work that's happening behind the curtains in a way, because there's a lot of work behind the app, and Sleip is always and the team is always trying to improve and bring the best functionality to their users, but also listening to the feedback of the users and trying to bring those features that have been requested forward. So two of the features that I would like to discuss today in these 10 minutes. One of them is the trends. So what is the trends? The trends is a feature that has already been launched since December 2024, which allows you to visualize and monitor horses' movements and health over time. We're going to do a little bit of a dive in, and I'll show you a little bit of some tips and tricks on how to use it. And of course, one of the features that is not out there, but we're really working hard on, and it will be coming in the coming months, is the possibility to do flexion tests. So basically, it's the possibility to label the flexion test recordings and properly interpret those recordings in a way that it's very useful for the veterinarians when actually doing those types of recordings. So the trends feature, as I just mentioned, it allows you to compare recordings over time and to navigate to the recordings list on if you have found a specific recording that you are interested in digging in a little bit more and having a better look on. There are a few requirements in order to being able to use this feature. So you need to have at least 4 different days of completed recordings. So as I said, trends is a way to visualize the longitudinal monitoring of your horse. So you need to have a few data points in order to use this feature. You're only able to look at data for one horse at a time. So you're not able to actually mix data from different horses or compare data from different horses. This feature is really built into looking at the individual horse and the progress of that horse over time. You can think about it looking at a horse, if you're just doing a health monitoring and following horses that are in training over time, or if you're thinking about horses that are doing a rehabilitation progress and actually seeing how the horse is improving. And this feature is only available for veterinarians and equine horse professionals. So when you actually invite a recorder user, as we call it, so if you invite your client to record at home with the light version of the app, they are actually not able to use this feature. So this feature is only available for people who have the subscription for Sleip. And it all starts with this little icon that you probably already found here on your recording list, and then you're able to navigate into this view. The way the data is represented is that each recording, as I mentioned, you need to have at least 4 recordings. So each recording is placed in this timeline. And you can see that the most recent recordings are placed on the top of the timeline, and it goes back in time as you go lower on this timeline. You can also see that there is a scale here. So when we measure our values for head and pelvis, we talk about these impact and push-off asymmetries, and these always have a value that can either be related to a left front or a left hind asymmetry, which means that they will be coming into the left side of the circle of this plot, or they could be related to a right front or right hind asymmetry, which would mean that these values, these dots, will be more towards the right side of this plot. You can also see that there are different colors here, and I'll try to explain that a little bit. So you can see that there are 4 colors. We have purple, and those indicate the asymmetries of the head. So if you go back to these sinusoids, or these vertical displacement curves, as we call them, we normally talk about 2 variables that we calculate, which is the push-off or the max diff, which in the trends view is described or plotted with this lighter purple color, and the impact asymmetry, or this minimal difference, which is in the darker color. Same for the pelvis. We also have this lighter color indicating the push-off asymmetry, or this max diff, and the darker color indicating the impact asymmetry. And these are the colors that are represented in this plot. So we'll try to drive you through a little bit on how we can actually use this feature and how you can navigate through it in this recording. So once you click on this icon for the trends, you will be brought into this navigation. And the first thing you're able to do is you can actually choose how much data you actually want to see on your screen. You can choose to see a month of data. That's how many months the timescale will go through, or up to 3 months. You can also see already here, we can see the name of the horse, and you can see the type of data that it's being displayed to you. So you can see here by default, we're showing you the straight line data of this horse, and we're not including any recordings with the diagnostic analgesia or recordings with the rider, because that could skew your data. But I'll show you later how can you actually include that data as well. At this point, you're actually able to scroll up and down. So you can actually go back in time, or you can go to your most recent recording. You are also able to click on these buttons, and you're actually able to select which component of asymmetry do you want to see. So for example, if you have a horse that is being treated for a hind limb asymmetry, you can hide the head data and focus on the hind limb asymmetry, and vice versa. What you're also able to do is when you see a specific time point with a specific asymmetry that you're more interested in looking at, you can actually click on this little icon on this ruler, and you're then able to navigate through this menu, and you're able to scroll up and down until you find the time point that you're interested in looking at. And at that point, you're able to click on that recording, and then you're brought into this already familiar summary overview. So you're able to see a little bit more detail of a specific recording for that specific timeline. Once you close, you go back, and I will show you a few more features. So for example, if you click on the settings icon, you can actually have some options, and this will allow you to show how much data you want to visualize. So as I said, by default, we show you the straight line data, but you're also able, for example, to see the left lunge data. And again, you're able to navigate and see the left lunge data, and the same as well for the right lunge data. And of course, the reason why this division exists is because, as you are aware, you can't really compare a straight line with a lunge recording. And of course, for lunge recordings, you always need to keep in mind the lunge or the circle-induced asymmetries. So you don't expect lunge recordings to be centered around 0 for all variables. And this is why we keep them apart. But this way, for example, if a horse has a very pronounced lameness, for example, on the left lunge, on the left hind limb, you're able to follow the progression of that lameness as the horse is being rehabilitated or treated over time. Of course, all I'm saying here today, you might forget at some point, and this is why we included a little guide. So if you click on the little guide icon, you will be brought into this guide where you can read all this information and all these explanations on how to access all your data and how you should do a proper interpretation of this trend feature. So I hope this explains a little bit how the features work and what it's used for. And of course, during the Q&A, if you have more specific questions, we can answer you to those very specific features. The next feature I would like to talk about is something that we're really excited about, which is the possibility to do flexion tests at Sleip. This is something that a lot of you have been asking, and of course, listening to you all, we've been working hard on this. So as you know, flexion tests are it's a provocation test that's normally done during routine lameness examinations, but of course also, for example, during pre-purchase examinations. So what is the added value of having this feature from what you already have on your Sleip application? Well, you will be able to label the recordings. So basically, as you are aware, after you do a recording with your Sleip application, you are normally able to add, for example, a diagnostic analgesia, and that information will come back into your summary view. Well, we will now allow you also to label flexion tests, so you can select a specific limb and select a specific region where the limb was flexed, and this information will be brought back into your reports and to the rest of the application. The other thing that you're also able to do is you're also able to link this recording to a baseline. And I will show you on the next slide how that works a little bit. And the other interesting feature is the possibility to actually look at the data stride by stride. Because as you know, when you do a flexion test, you're interested at looking at the horse every stride as the horse progresses after the flexion test. You want to see how many strides it takes the horse to go back to baseline. For how many strides did the horse actually react to your flexion test? And in this visualization, you're actually able to do that. I will show you a little bit more how that works in this navigation. So in this prototype, you can see that once you've done your flexion test and you've labeled your flexion test, under your summary, you will see this new plot where we actually show you the data from your flexion test. You can see again, just like with the trends, that we have the head strides plotted in purple and the hind strides plotted in blue. And again, with the different components for push-off and impact on different tones of the color. You can see that again, the strides are plotted in a time sequence, with the first strides being plotted at the bottom, meaning this was the first stride after the flexion test, second stride, third stride, so on, all the way into the 10 strides after the flexion test. And we do that for the head, and we do that for the pelvis. What's quite an interesting feature, of course, is because when you look at a flexion test, you need to make sure that you are able to compare that flexion test with the baseline. You want to see how was this horse before and after a flexion test. So you're able to select one of your recordings that you have performed before your flexion test, and you can see that once you have linked your baseline, you are now able to see on the background of that plot what was the average and confidence interval of your baseline. So from now, you are able to actually see each and every individual stride from your flexion test and how has that horse increased or decreased the asymmetry in relation to your baseline in order to interpret your flexion test. You can count how many strides the horse was above your baseline or below, and you can see how many strides it actually took the horse to get back to the baseline values. So hopefully this will be a feature that will be very useful for veterinarians performing these tests on a regular basis. And just to mention, of course, using the current Sleip app, you are already able to do flexion tests, of course, but you're probably familiar with some of the warnings you might get. For example, there are few strides or few passes. Of course, when this feature is launched, and if you're doing a flexion test, we are aware of that. So we will ignore those normal warnings that we have today. So you're not going to be bombarded with warnings about low number of strides or few passes, because it's a flexion test. We are aware of that. So again, hopefully this just gives you a little bit of an idea of what's coming in terms of this feature. And hopefully if there's some more questions during the Q&A, we can continue there. Back to you, Aylin.
Thank you so much, Philip. And I think Marianne already said that she does flexion tests anyways, and soon, as soon as we can, Marianne will make that even easier with this new data view. So hope you guys will enjoy that. So what we're going to do now is actually open up for a Q&A session. And we had some questions sent to us that I think, Philip, maybe you can pull them up, but I'm going to sort of sneak in between with one question, because we had a very good question directed to Andrea about your, and I'm thinking the acronym is normally PPE, like pre-purchase exam. And when you have a pre-purchase exam, that has to be a PPPE, right? So when you do a PPPE, Andrea, the question is, don't you have a subjective view on the horse at the time of the clinical examination? So
a pre-purchase is just to know if any vet should spend time to go there. So if the owner goes and see a horse and likes the horse, but Sleip shows that it is actually 2 out of 5 degrees lame, and we can see that with the data as well, both in the video and in the data, then there's no need to send any vet or for me to go there. So there's no combination with any clinical. Of course, if the person wanting to sell says, oh, but the horse fell and hit the shoulder yesterday, maybe that's why, then I'll say, okay, if you really want the horse, then go back and see it in 2 or 3 weeks and then do a new Sleip. And if a hoof abscess comes out, then do a new Sleip, and then a vet might come and see the horse.
So it's more of a selection of the horses that should go to PPE, and I think many of us would have, the first thing we do is trot them not to spend all that additional time to do a full exam during a PPE if we know that the owner wants a very sound horse. So I think that is a very, very nice screening tool, and I think it's a great service. I do the same thing, Andrea, for my horse owners, shopping for horses in other countries, specifically where it's very long travel to go see them, or finding a local vet. So I think it's a great service you're providing there. But always use the eyes, and that's of course, a very big thing for us at Sleip as well. We would never say that these objective measurements replace any visual assessment. Of course, also not palpations or the physical visit. It's a complement to what we do, and it is a very precise and specific measurement. And Dr. Marshall Gibson told us very well, also, I think that, it is this vertical motion asymmetry that it measures, and that's also not the entire truth of the motion pattern. So there is a lot of additional things to add to that as well. But Philip, I think you can go ahead and take the first question that I know you had time to prepare.
Yes. So this is a question that we often have, which is how does Sleip actually quantify lameness severity? And this is the understanding behind the severity color and I don't like to call them thresholds, but reference values, detecting and how we detect these small improvements. So just to warm up a little bit the Q&A, the answer to this question, I would have to start by saying, well, Sleip measures asymmetry. We don't measure lameness. And that's a very important thing to say when we're talking about objective gait analysis, because what we're measuring is a movement asymmetry, and that can or might not be caused by lameness, and is up to the clinician or the professional to actually make that determination. And what we're doing is we're measuring these asymmetries on the head and on the pelvis. What we have is this color scale, which is basically related to the values that we're measuring at Sleip based on the computer vision technology that it's built behind. So to give a bit of an explanation, what this mild asymmetry corresponds to, in a way, what is the middle of the scale? What we have done is we actually have had a panelist of experienced veterinarians looking at videos and grading lameness actually on the scale from none to very mild to mild, and we have actually aligned our values to correlate in a way to the visual assessment. And just to give you an idea, so these are the values and how they relate to our color scale. So a value of 0.5 to 0 to 0.25, it's the color green. 0.25 to 0.5, it's colored in gray. 0.5 to 1 is colored in yellow. 1 to 1.5 is colored in orange, and 1.5 to 2 is colored in red. So this is the way that these different severity colors are presented in the Sleip application.
And we had a very good question from, I think, Professor Roger Smith, who uses the application as well. And he was asking about these, as Anushka was saying earlier, like when you get this swap between colors, and like, do you always compare with the actual number or the values? And I said, yeah, well, I like to use the values for sure, but I think it's particularly important to not only rely on colors when you're comparing two recordings. But then Professor Smith had a good question about these decimals, and maybe you guys in the panels have the same feeling here. Like there's not an endless amount of decimals here. So sometimes you even get the same decimal values, though there is a small difference for sure. So Philip, do you want to say something about that? Because I know we've discussed a lot. Or yeah, you can push it back.
So I can explain. I can explain the reasoning behind it, and I can also explain that we're actually at the moment working on improving that a little bit. So one of the things that you can see here, for example, you can have a value of 0.25, which is just on the borderline between green and gray, and depending on you can actually have a value, for example, of 0.24, it's a green, and then you can have a value of 0.26, which is going to be gray. But the app, as you are familiar, we normally round the values to one decimal place. So during this rounding, when you actually look at the data, you might actually see a very similar value, but the color is changing. So it's very important not just to look at the change in color, but also to look at the change on the actual value. So always look, and what I'd normally try to advise is when you're using the compare function, you can look at the percentage of difference. So you can see if there's a 50% improvement or a 100% improvement, but also always look at the absolute difference. So make sure that the differences that you're looking at, it's not just the difference in color, but that you actually have a significant difference in the amount of asymmetry. And also always be very careful looking at percentage of difference for very small values, because you can go from 0.1 to 0.2. Yes, it's quite a large percentage, but is that really clinically significant? So always keep those things in mind. I hope this answers the question.
I think that's great. And in a way, you know, we're dealing with objective stuff here. And I think our panelists really showed as well that the data is important, but also sometimes over focusing on many decimals, maybe that would take us away further from the clinical picture. And I think, Anushka, when you show like looking at the spread of the measurement and a little bit sort of eyeballing the data, sometimes that gives you enough, or that should give you enough information so that you don't over rely on, you know, a small change in a few decimal numbers. That's not really the way you should use this data, because we know from research that there's a lot of stride by stride variability. And Andrea, I know you actually did your thesis on this as well. So the consistency, as Anushka said, is really important. Any comments from you guys in the panel about this? Okay, I think we're good. So you can continue with the next one, Philip, and I will find some more in the Q&A.
Yes. So one of the next questions we had was how does Sleip handle natural or anatomical asymmetries? For example, a horse with a pelvic tilt or a pelvic asymmetry. So one of the important things to keep in mind is that we're tracking these specific key points on the horse. So for the head, we're actually tracking the position of the head, but for the pelvis, we're actually tracking the midpoint of the pelvis, so the tuba sacrale. So this means that, for example, when you have a horse with a naturally asymmetrical pelvis, this does really not affect the vertical movement of the tuba sacrale as we're measuring. Of course, depending on if that horse actually has a pathology associated with it, or if the horse actually has a weight-bearing asymmetry caused by this asymmetry, that could induce an asymmetry, measurable asymmetry. But just the fact that the horse has an asymmetrical pelvis doesn't mean per se that we will expect or not expect an asymmetry. As I said, we measure these impact and push-off asymmetries, and these are more related to weight-bearing asymmetries. One thing to be, of course, careful about, and there are two very interesting papers about this, one from the group from Thilo Pfau and the group from Kevin Keegan, and they actually look at horses, for example, with limb leg differences. So when you have actually an anatomical difference between the hind limbs, especially, this can be due by bone differences, but it can also be a hoof length difference. And what they saw in these studies is that, yes, if you have a limb difference, you can actually induce an impact and a push-off asymmetry on these horses. So not just about the pelvic asymmetry, but also always keep in mind these anatomical asymmetries that the horse might have. And those can very well create a measurable asymmetries when it comes to impact and push-off asymmetry.
And I'm throwing in a question here from the audience, and maybe first to you, Philippe, is there any science? I'm asking the scientific part here, but the question is actually like, if you have a push-off asymmetry, do we know what that is? Like, is it a suspensory? Is there a scientific answer, Philippe, to that?
I don't think, as far as I know, that there is a straight answer. I know that at the last ISO presentation, I think the group from Uppsala, Eilen, actually had an abstract on this, and they tried to look at specific horses that blocked to specific block and had specific types of asymmetry, but they were not able to find a clear correlation. So we're not really yet there, as far as I know, trying to understand if a specific type of impact or push-off asymmetry is related to a very specific disease. I think hopefully we will get a little bit closer, but I think we need a little bit more information than just that specific asymmetry. One thing that is important, that something we from our experience is these head push-off asymmetries on the straight line. And that's something that it's still a big question mark for a lot of people, because we don't really know what a head push-off asymmetry on a straight line means. In some horses, it might actually mean, and we see that sometimes with horses with bilateral lameness, but it's still a bit of an unknown pattern. But to be clear in terms of what has been published so far, we don't have a specific correlation between a specific pattern and a specific disease, as far as I know.
No, that's true, Philip. The science isn't there yet, but is clinical gut feel or clinical experience somewhere close to this? So I'm asking the questions. I don't know, Marianne, do you have a clinical opinion or what you would think? You have only a push-off asymmetry from a hind leg. What could that be?
Oh man, yeah, I really don't. I mean, I think every horse is a little bit different, because I think that gets in a little bit to that example that I gave where I think lameness can be 3D, right? So I don't have a great answer as far as the patterns that I've found so far. I don't know if Anushka or Andrea have other
Yeah,
opinions.
please jump in, guys, because I think this one is really exciting.
Yeah, I would be like in the same position, and also I sometimes get really surprised by my nerve blocks, and I'm like, when I think I have a suspicion for a particular area and I pop a nerve block in and I get an improvement, I'm like, oh, God damn it, I wasn't expecting it to improve to that particular block. It can be really frustrating. But perhaps more often with push-off asymmetries on the forehand, maybe I'm suspecting something higher up and, more kind of sometimes proximal suspensory and above, but quite often some neck-related pathology as well. So
if you have a one in the front legs, I guess. The head
sorry?
Is that for the head push
off? Yeah,
Yeah.
particularly if that's on the lunge as well, on the outside. Yeah.
And Andrea, what do you see? You have a hind limb only push-off pattern from one hind limb. What do you say? Suspect?
I'm not doing all the nerve blocks, so but what I normally get back is something around the tarsus, yeah, higher up in that hind limb. And I also, as Anushka, I find that if you have that front limb push off, you sometimes might not have any reaction to blocks, and you end up in the lower neck with the type of cases I get.
And I think what Philip also described for the front there, we haven't really figured out sometimes if horses only have a push-off asymmetry on the head. We clinically often think that it matters if they're sort of jerking the head or if they're jumping with their entire front end. And particularly in some of these horses that are gaited, we have a lot of Icelandic horses in Scandinavia, and those we can see a little bit of a jumping behavior in the front. And even though it might be a hind limb issue, that is not very easy to see on the straight. So it's not getting super easy just because you're using objective gait analysis, but you get more precise, you get good documentation, you get support along the way, but it can still be very complicated to do lameness, and I think it often is. So we'll jump to the next one. We have a question from Adeline Tischmacher. Sorry for my German. I think that is not maybe the right pronunciation. Are you planning to add data on the withers movement, Philip?
Yes, that's a very straight answer. And the answer is yes. We're currently working on that. So that's one of the features that hopefully will come in one of the future updates of the app. So for those of you who are thinking about the withers and what's the usefulness, so there's been quite a lot of research also coming from Uppsala and Utrecht, where and Zurich actually, where it has been found that actually the vertical movement of the withers can help you better differentiate from horses when you have, for example, horses with a head and a hind asymmetry and trying to find out if it's a primary front or a primary hind limb lameness. And that has shown that the vertical movement of the withers is a nice addition to the typical law of sides guide. So the straight answer to that is yes, this is something that we are developing at Sleip, and it will be part of a future update, hopefully soon.
That's great. And then I have another question from Paul Abril, who asks, sometimes I get an orange plot. So that's, something that is up to a larger degree of asymmetry, but I can't see an expected obvious lameness at all. Or I would expect a more obvious lameness with that degree. Does the degree measure always correlate with a visible lameness subjectively? And I'm going to start with you guys from the clinical side, and then I think Philip can give a scientific version of that. Does that happen to you guys? Anushka, does that ever happen to you? The Sleip says super asymmetry, and you are like,
yeah.
what?
Yeah, I have that. Yeah, definitely often. And that's why I threw in the comment about it's okay to get it wrong. I mean, sometimes you can't see it, or our eyes tracking different things, and I think that's okay. And then I try and correlate it with what I'm seeing on the lunge as well, or what the lunge data says, and to reinforce, okay, it is something that we really need to follow. And also, I would say, particularly on the forehand, that sometimes we get these orange red kind of plots with horses that have a very fixated a head and neck position, like, a quarter horse is just going around with its head like, this and doesn't, really have that sway. And so sometimes the push-off data, I think, can look like it's a really bad push-off lameness, but I think it's just the horse's way of going, is my opinion. And I've talked to Felipe about this. So I don't know if anyone else has got some other opinion on it.
Yeah, but that's great, Anushka. I think we have all experienced that, and that's actually a reason why we changed the scaling to be related to the anatomical size of the horse and not only to that sort of bounciness in the vertical direction. Has that happened to you, Andrea, that there's a big asymmetry measured and you can't see it?
Yes, of course. And then when I look at the video afterwards and look at the curves, then I can see what happens. It's always front limb for me, and it's always the push off that I sometimes get, where I get an orange plot and I'm like, why?
Yeah.
And
That's
I
a
have
very
it.
good observation. Yeah, and maybe, do you think you can see if it hurts, like if an asymmetry is there and if it's hurtful? Is that what you pick up with your eyes, you think?
I don't know, but I mean, both right now I have two horses that I've been following for a year, and they've been in the start of the breaking in, and they look like that. And now, let's say now it's yellow, push off right front, but I'm just following them. They send in data every month or so, and then with one of the owners, we are trying all kinds of different training ideas with poles and with not poles and with lots of cantering and not lots of cantering, and then we're trying to figure out, because of course we would like that asymmetry to go away, because the purpose is for this horse to be sold at a point. The other one is owned by one who's keeping the horse forever, so she's like, as long as it's good written and it's been checked by, vets and blocks, and cannot find anything. So what I see in both of them is they have very different hooves. So there's a steep and not steep hoof in the front of those two horses.
Yeah, that's interesting, biomechanics. And Marianne, do you see this as well? Sometimes is it more on the circle, you think, or on the straight that you have these asymmetries that you think are you don't see them as clinically important, and then they are measured?
Yeah, I would say probably more in a lunge, and I agree. For me, it's more front end, and a lot of times it ends up being more cervical. And so there's just, you see something and it's just kind of like, okay, it's not entirely symmetrical. And then you look at the plot and you're like, huh, okay, I guess that must be relevant. But your eye just doesn't quite catch it. And, just to Anushka's point too, we here have a lot of these, quarter horses that they're just trained to keep their neck at a certain area and they never move. And so I think sometimes in those cases in particular, when you have no reference point, right? I've definitely seen that happen as well. Mm-hmm.
Yeah, and that used to happen quite a lot, I think, with the old scaling, for me at least.
Yeah. And that has definitely improved with the scaling. So that's been very helpful.
That's great. And we know that happens. And that's why we think from Sleip's side that it's so important to say that what we measure is not lameness. What we measure is vertical asymmetry. We know from biomechanical research that that's very well related to an asymmetry in the forces underneath the limbs. But lameness is something that's up to the veterinarian and the clinical examination. And I think sometimes you see one of these push-off asymmetries, it doesn't always look as if it hurts. And sometimes you have the feeling that when you see an asymmetry and you go, ouch, 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 that's a different story.
Mm-hmm.
Any additional comments on that, Philippe, from your more scientific side?
Yeah, I mean, in terms of the types of asymmetries, from my experience, I think different types of asymmetries are more difficult to see subjectively. I personally can't see hind limb push-off asymmetries. I really tried. I take my glasses off and I put them back again. They're really difficult to see. And the same thing with the head. So that's actually something quite important, for example, when looking at or trying to understand the importance of specific asymmetries. for example, if it's just a head push-off asymmetry, which is very difficult to see on a straight line, and that's also an asymmetry that we still don't really know what is the biomechanical meaning of that asymmetry, those are the types of asymmetries that would have to take it with a grain of salt. But I think especially push-off asymmetries are known to be difficult for the human eye to see. I think we're somehow a little bit more trained in a way, or more focused on the impact asymmetry than on the push-off. So yeah, that's my my opinion on that.
Yeah, and my experience is a little bit different between people a little bit as well. Guys, I think we have time for one more question, and I'm sorry, I see more questions in the chat. We have Professor Marta Pradas here from Barcelona. Hi, Marta. I will answer the question to you specifically about research values and statistical analysis. We have some great product suggestions from David Svensson, and we will just say, Andrea, when you look at these pre-PPEs, again, the PPPEs, when would you decide that the horse is okay or not? Is gray okay? Is yellow okay? So a little bit like this, like what is okay or not, if you want to dig into that one.
Yeah, so that depends on a lot of things. It depends actually first on, so of course, if it's above yellow, there's no reason to go see the horse. But if it's in the zone of green and gray and yellow in the front, and especially if it's this push-off front thing, then I might say fine. And then in the hind, normally it's the green and gray. But it depends on the risk that the owner wants to take. It depends on the age of a horse, because I'm following also horses from foal to 1 year to 2, 3, and the thing I see here in Denmark with these young horses is that the symmetry varies a lot, and I find that it has no big relation to the lameness, because the variation and the confidence interval around this variation is huge. So in those very young ones that are not normally lunged, I accept more asymmetry. And in the well-trained horse that is supposed to be bought for €1 million, I might say, okay, a bit less. And then it also depends on, some owners has been like hurt on let's say 2 horses that they bought that didn't work, and now they just really need one that is perfect, and then they might wait a year until this horse comes. And then others, they're like, I want a horse now. So you can choose between these 8 I've seen, and one of them I want to go to pre-purchase, and then I choose one of them.
Yeah, and buying a horse is not an easy task for anyone, of course, and it's not easy to be the vet involved in that either. Guys, I think we will say that that's it for tonight. We're so very, very grateful for all of you to attend. Marianne, Anushka, and Andrea, a million thank you. And, you know, I also have some more questions I would love to bombard you with at some point. We've had some more questions in the Q&A about a rider and horses, and to evaluate the horse under the rider. Maybe that will be a theme for a future webinar, because I think it is a big topic to discuss. And thanks, Philippe, for scientific advice and for the new features that we are waiting to get in our hands. And thank you everyone for attending. And I think that's it.
Thanks, Aidan.
Yeah. Thanks, everyone.
Thanks, everybody.
Bye-bye.
Thank you.
Have a good day, night, morning.
Thank you.